never underestimate the power of manifesting, because this mama got exactly what she wanted. And I know we don't always, but in this situation, it was well-deserved. Anybody can do it. Don't overthink it. Just use common sense and it will work out. When life stresses come, we can stand strong like a tree.
Okay, welcome back to Her Health, Her Way. I'm Jen Kruba-Couch, and I am so excited for this episode. I think it's my favorite episode to date, and we have Stephanie Fritz, and she is a midwife and author, and we go over before conception, infertility. We talk about the first trimester, essential oils, holistic care, even traditional care, and the second trimester issues that might come up. Second trimester is the most fun. And then the third trimester, when we're big and uncomfortable, she's going to give you lots of solutions to help care for your body. And then we also talk about birth and beyond. And she gives you so many resources, so many things that you can take away from today to care for your body. So whether you're a woman looking to conceive, whether you are a mama in your first, second, or third trimester, or about to give birth, whether you're a grandma, this episode is definitely for you. Hello, Stephanie. We are so excited to have you here today. One of my very favorite topics, talk about birth and babies. I am a recent grandma and loving that role, but as a home birthing mama myself, I just love everything about it. So we are so excited to have you here, an expert midwife and author. So tell us what drew you to midwifery and the holistic framework surrounding it. Like what really drew you to that profession?
Honestly, it was when I had my own kids. My first one was in the hospital, and we were both still in college. It was, we were young, and I thought, oh my gosh, there has to be a better way to do this. And so when my second one came along, a friend of mine said, you ought to look into a midwife. They're a lot cheaper. And we were still in college and still paying for our first one. So that sounded really great to us. And when we interviewed several midwives, and one of them that I was, visiting with and interviewing, just stood out to me. And in that moment, I remember thinking, especially my very first prenatal with her, I remember thinking, this is what I want to do. And I want to create it just like she has. And so that was way back in the early 80s. I think that was maybe 83 or 84. And so in 85, in 85 is when I caught my first babe. And so it's just kind of been, from a long time. And I feel like there's so many gaps that we have in prenatal care. And when you see your OB or your typical, OB care provider, that I just wanted to fill in those gaps. You don't know what you don't know.
Absolutely. No, it's so true. I was actually just talking to a friend pregnant with her first baby, and she was saying a lot of those things as well. No, I love that. So how many babies did you home birth yourself? Like, I guess I shouldn't say how many did you bring into the world. How many did you have your own babies? Like
my own children. So I have 4 daughters.
Wow.
And 3 of them were home births. One of them was unassisted because there wasn't a midwife around close enough that would take me on, and I had very quick labors. And we ended up, having it unassisted, which I don't recommend, but that really led me down the path that I'm on. I also had one where my husband was deployed, and so he wasn't there, and I had her without him. So I've had the full spectrum of those clients that I help too. I can honestly say I've been there. I know how you are. I know how you feel.
Yeah, you can identify with all walks of life, single mamas, and then those that that have had hospital births and want to do a natural birth. So my story is so similar. My first baby, I just didn't really know it was an option to do a home birth. And then I had him in the hospital. I hate hospitals, not to say anything bad about hospitals. It's just, for me, it's not a good scenario. And then I had my 2 girls at home, beautiful experiences, home births in the water. So I support a woman for however she wants to have her baby, but I especially love home birthing and letting a woman's body do what it's meant to do. And it can be a very pain-free experience. As I experienced finally with the third, right? I got it right on the last one. Biggest baby, 9 pounds, 8 ounces, but got it right with her. So,
and that was my experience too. My biggest, almost 10-pound baby was my easiest. And that was the one that my husband wasn't there for.
Oh my gosh.
And so it was like the angels were saying, I'm sorry you have to do this like this. I promise it's for your good, and I'll make it as easy on you as I can. And so, yeah.
Oh, that's beautiful. No, that's an amazing accomplishment. Wow. I had, I think, 3 midwives with my last one because the one that trained the other ones was home and lived in our area and just happened to be home. So she had a baby of her own and she brought it and helped the other midwives. So it was kind of a fun experience. Yeah.
I definitely have a team of midwives that I work with also. I certainly have done births by myself, but that's not my preference.
It's nice to have those extra hands because you've got mom, you've got baby, you've sometimes got dad who's going down too. You never know what might be happening. So you primarily do home births, or do you do birth centers? Okay.
Home births. My training was in a birth center, but did both at the same time as well.
Nice. And sounds like you've been and that's a job where it probably is hard to have a family because babies come at all hours of the night, all times, like holidays they don't wait for, and there's a lot of false labor and, especially the first time mamas, they don't know. I mean, even with my third, I think I went into labor, I don't know how many times, I guess it was false labor, but it was no different than my actual labor. Contractions were identical, but so you get a lot of interruptions in your personal life. It's a very big undertaking.
Absolutely. And in my family with with my kids at home, they were all young, and growing up. I mean, they grew up with this. Our dinner conversation, our table conversation was very different than your typical family conversation, but we always had to have a plan B. And so if mom has a baby that's due at Christmas, okay, what are we going to do? Are we going to wait till mom gets home? And everybody agreed. We had we would always have a family meeting, same with birthdays and any holidays, because babies just come when they want. There were vacations that I missed out on, family trips that I missed out on because I was committed to this, to this mama. And I remember one in particular where I had a cruise planned, and I thought she would go before I left, but she didn't. So I left her in good hands with my team. Well, she waited until it was her 2-week overdue, and that's when I got home. And that morning she went into labor and had her baby. And so, there are times that I missed it, but also many, many times when moms either waited or had it before I left. So
it is amazing the way that our brain and our mind can somewhat control that, because they claim it can't. And I guess, and sometimes, like for you were a very quick births, but I was always overdue with my babies, and it always seemed like I had to mentally be ready before I was actually going to have them. And sounds like for that mama, she was probably just, waiting for you. And then she got comfortable. You were home and everything relaxed and baby was ready.
Right. And I had another mom who, she was a midwife. She was actually on my midwife team, but she had a few kids. I think this was maybe baby number 5 for her. And in 11 o'clock at night or maybe midnight or so, I can't remember, in the night, her little 2-year-old woke up and wasn't feeling good and just needed consoling and needed her mom, and her labor completely stopped. And we went to sleep and took a nap, and in the morning things weren't happening again. So we went home, and that night it was 11 o'clock, I remember, because I got called out again at the exact time that her little one had woken up the night before. And when we got there, and we had a baby within 10 minutes. So her labor stopped for her because it needed to for her energy. And then when it was safe again, it picked back up.
Yes, it is. It is amazing. And I mean, I think they see that in nature with animals, not, I
Sure.
mean, yeah, like they will not give birth until it's a safe place. So it's very fascinating. So you've written a book, right? So there are resources out there that our listeners can learn from you through. Yes, I have that book and I have referenced it many, many times. You also integrate essential oils into your practice. What how did you find out about essential oils? How did you get into them?
So essential oils are still part of that holistic world. And so I was using essential oils since the 80s as well. But I never really brought them into my practice because I didn't feel 100% confident with them.
Right.
And it was actually in 2008 when a friend of mine said, there's some new oils out, you should check them out. And I got that ping from head to toe, that instant feeling that, oh yes, I do need to pay attention here. And so I just kind of intuitively, really, that's what it was. I learned about these oils and I ordered all the oils that they had in the first time. And I remember having them set out in my living room floor, and I was, smelling each one of them. And it was when I smelled frankincense that I was blown away. And I'd never smelled a frankincense like that before. Yeah. And I thought, okay, these I feel like I can bring into my practice. And so I did that very, very slowly. One mama had, in fact, the very first time I even used them, mama had some abuse history. And so I put Balance, the grounding blend, just on me so that I would be grounded and fully present for her at her birth. Yeah. And she just she smelled that on me. And then later on, we were doing a water birth and she was in the tub and she was having a panic attack. And she says, Stephanie, I need you near me. She didn't know it was an oil she was smelling on me. She had no idea. But she just says, I need you near me, like in the tub right here. And I knew exactly what it was. So I had my assistant run out to my car, grab my oil. I just took the lid off and she smelled it and, she threw out the rest of her labor. Yeah. And her anxiety calmed down and she was able to have a beautiful birth. And it was on about day 3 of her postpartum that we debriefed. And she said I was having flashbacks, and it was that oil that kept me present and focused in the moment. So I thought, okay, I'm never without that oil at a birth. And that's how many of my oils, many of my experiences with oils and blends that I have came about. It wasn't from reading something off the internet or anything. It was my own personal experience. And so the blends and the things that you read in my book about the essential oils truly come from my own experience.
That's beautiful. Yeah. What a gift to have a tool like that, to be able to soothe anyone in general, but especially a mama in labor like that. It's such a gift to have these tools to us. Let's talk about supporting clients that are having delayed conception or infertility issues. Is there anything that you found in all of your experience to kind of support their bodies, to help them along with that? Essential oils, supplementation, or even just maybe a mother who's planning to conceive soon to get her body ready?
That's a great question. Thank you for asking that, because I feel like whether you are trying to conceive and having success, right away, you've not ever had any problems, or whether you are having issues, a good cleanse to prepare your body and for the guys too, because they're part of that. And so I recommend a cleanse for both mom and dad to get ready for conception. And then if there are fertility issues that you're dealing with, then I might take that to another level. It may take, more like 5 or 6 months of a cleanse in order to really get things ready. Because in the end, what we're trying to do is balance hormones and help hormones that are, remember what their perfect blueprint, if you will. And so whether it's getting ready to conceive or having issues, it's all about that balance in hormones. And so I'm going to definitely recommend a cleanse. doTERRA has amazing essential oils that assist with that. They also have supplements. And then there are sometimes, my toolbox is big. I have lots of different tools in my toolbox to pull from for that. And also, it used to be years ago, I saw clients after they got the double line on the stick. And so they were already pregnant, and I saw them through their pregnancy and their birth and postpartum, and it was all beautiful. And as of late, probably the last 5 or 6 years, I'm seeing way more couples with fertility struggles. And so now my focus has changed. I still help many pregnant women, but I've also included that fertility and hormone balance along with that because it's so needed.
Yeah. This is kind of a question we didn't really talk about, but what is your thoughts on why infertility has spiked? I've heard the same thing. I just feel like it is such a struggle in so many people, and I don't know what's going on. Is it people waiting till a little bit later in life to start a family and things are just shifting? Maybe they've been on birth control for many years, hormones need to balance like you're saying. What is your theory?
That's a really
rabbit trail.
Yeah. But you asked, so I'm going to give it to you. I think especially because of the time frame that I saw this shift, I think that it was, it's a culture change. When COVID hit, there were lots of changes there.
Right.
And whether you had the COVID shot or whether you had COVID, it doesn't matter. Either way, you have the spike protein, and that shifts everything. And so just as a personal experience, I had COVID, but I did not have anything to prevent that prior to that. And so, but I had COVID 3 times. And each time it got, it was milder and milder, but my journey has been Lyme disease. And so I am, do treatments, if you will, for Lyme disease, natural, holistic. And the last time I had my blood drawn was in March. And I did some ozone therapy. And so he drew the blood out in a big syringe, and you could see the spike protein in that blood. It was like a white fibrous tissue. I had no idea that you could actually see that.
I had no idea either.
And so that was, it wasn't from any outside injection. It was from the spike protein that I just got naturally through. Anyway, so back to your question. I think that has had a major effect on our bodies and the health of our bodies and what they do.
Right. No, that makes perfect sense. And I kind of thought maybe that would be the path that you would go down, because I've heard the same thing. So very interesting for sure. When you talked about a cleanse for a woman to prepare, or in a man as well, is that something that you could guide them through, or we could even list in the resources, or is it best to kind of talk to you about a cleanse? Is that typically the path for them to take, or?
I do have a fertility cleanse that I do, or a hormone cleanse that I do. And so we absolutely can list that in the resources, but also I do private consults. So it's targeted for exactly you and your needs and what, because every body is different. And so whatever that need is and whatever your body is telling me, that might direct how, the little tweaks I do in that cleanse for you.
That's great for our listeners to know that while they may not be seeking you to deliver their baby at home, you do have the option for them to have private consultations and things like that. So even if they plan on having a hospital birth, they can still do lots of things naturally to conceive
100%.
through each trimester. So
in fact, I have a virtual midwife program where I walk you through. I'm your midwife virtually, so it doesn't take the place of your care provider.
Right.
I'm just an extra person because honestly, you get 7 minutes with your doc, with your OB.
Right.
And he's got his hand on the door ready for his next patient and asks you if you have any questions, and you don't know what you don't know. And so I'm here to fill in the gap. So you have your appointment with him or her, and then we schedule a 1-hour prenatal as if you were right here in my office, and we do that over Zoom. And I'm able to fill in all those gaps for you and give you the like childbirth education also that you need, all the things with the information that, you didn't even know what you didn't know.
Right. No, absolutely. That's fantastic. I didn't actually quite realize that you did that. That's so amazing. I
have clients all over the world.
I bet, because that is just such a
take
need
advantage
for
of that. Yeah. The time change is a little tricky, but we worked out.
You work through it. No, that's amazing. Okay, let's go into someone does conceive, and then they're in their first trimester. What are some of the most common concerns that you see with all the mamas that you've taken care of in their first trimester? I mean, I think most people know all of the symptoms that most women incur whenever they become a new mama. Not all, but a lot of them. And then what do you recommend?
So probably the first sign is that nausea. And so I have, there are essential oils that we can go to help with that, like peppermint, ginger, fennel. doTERRA has a digestive blend that is like a combination of all of those digestive oils that help. Cardamom behind the ears is amazing. Cardamom and ginger come from the same family, and they actually block those nausea receptors. And so they're great to put like behind your ears, behind your neck. Also right here is very thin skin. And so the oils get into your system very quickly, putting it right there. You can also take them internally. So doTERRA oils, let me see if I have one that might, no, I don't have one here. Anyway, they have a supplement box on them. And if it has a supplement fact box on it, then it's totally safe to take internally. And so like peppermint would. And you could make a peppermint tea, and that would help that, help that nausea. Then there are other things like pregnancy exhaustion. That's another one that is right. And that's like a 2-part thing. So I have a supplement that I recommend that is, it like feeds the mitochondria, the battery of your cells. And so that helps keep you, give you the energy that you need. Also, it really helps with your adrenals, because often your adrenals are fatigued. They're kind of, they're hashed out in pregnancy. And so I have a supplement, that same energy supplement that helps with, with your adrenals. And then there's magnolia. Magnolia is a fantastic oil. Basil is another great one that if you put it right on your adrenals sit like little caps right on top of your kidneys. So in your low back area. So that would be the area that I would apply the oil to help in that area. Oils will, if you're using them topically, it's best to put them wherever you're in need of. So like your adrenals, you'd put on your low back. If you had, nausea or digestion issues, you'd put them on your tummy. Your belly button is the sweet spot. If you had sore joints, you would put it right on that joint. So those are a couple of things that are right off the bat, right out the gate, struggles in first trimester.
Yes. The energy supplement is that Mito2 Max or
Mito2 Max? Yes.
Okay, perfect.
And that is a fantastic supplement, all natural, whole food, great and safe in pregnancy. The thing is in pregnancy, there's not very many things you can take. And so anything that I recommend is absolutely safe in pregnancy and breastfeeding. And if it's not, I let you know, but most generally it is. Yeah,
I'm glad you said that, because I think anytime a woman becomes pregnant, she gets very fearful of anything she puts in her body. And with good reason. So I think that's very helpful because, and a lot of doctors are not trained in essential oils. So they may not even know whether they're safe or not. And when they say they're not safe, the ones on the grocery store shelf are not safe. Like, we are only talking about doTERRA. So that's an important point to make. Now, what about a prenatal?
Great point.
Do you
So yes, I have a favorite whole food prenatal that I recommend, and let me preface that it is not a prenatal. It's not labeled as a prenatal, but doTERRA has an amazing whole food powder that's a freeze-dried powder, everything natural and whole food in it, that covers everything that you need for a prenatal. There might be a couple of extra things I might recommend, like chlorophyll or choline, some things like that. If you're low in iron, I might recommend a little extra iron. Mm-hmm. Those are things that you would take extra with any prenatal anyway. So the reason I like a whole food choice is because if I were to get a text on my phone and I can read that text, and every emoji, every exclamation point, I can read the feeling behind that text. But if I were to turn that around and now try and read it in front of a mirror, I would get the gist of it, but not everything. Some of that would get lost by the wayside. And that's the way a synthetic prenatal works. So your body it has to figure out where to put it and what exactly it needs. And if it can't figure that right out, it just tosses it. And so you have expensive pee. Whereas the multivitamin that I recommend, your body gets to absorb that, every bit of it. It also stays available in your body for 6 to 8 hours. So say 4 hours later, your body is in need of a little extra vitamin C. Oh, it can go grab it and use it. Whereas a typical synthetic prenatal, it's gone. You use it in that moment, and whatever is not used up, it's gone.
Yes. Yeah, that's such a good point. And our VMG has essential oils in it. There's like no multivitamin type of product in the world that has essential oils, which do incredible things. They're doing a lot of studies on that, which you may have a little more insight. But pairing the essential oils with nutrients is just blowing my mind on how they're delivered, and we're uptaking them so much better. So we'll make sure we link all of these things that you're recommending with your link in the show notes as well.
Awesome. And essential oils are messengers. They are messengers to our body. So it helps our body know so that's why it's so brilliant that they put the essential oils in the VMG, in the 𝗬𝗵𝗲+.
Yes.
In many of our supplements, almost all of our supplements have essential oils in them. And they are actually messengers that help tell our body how to use these different other supplements and things that we're doing.
Yeah, it's brilliant. It's super fascinating. I don't even know if we fully understood it until it was created, and then we saw the effects, like you said, the way that they're staying. These supplements are staying in our body so long, sustaining us. And that's a good point. You mentioned the 𝗬𝗵𝗲s. So that would probably be something else that you would recommend along with the VMG for
Yes, I have a foundation. I recommend the VMG, the 𝗬𝗵𝗲, the PB Restore, that's our probiotic. And I love that it is a timed release. So it's in a dual chamber capsule. So the first part of it is chlorophyll that actually feeds the good bacteria so that it can, when it gets into your GI tract, it can actually be released, and that's where it can do your body good. So those three things. I love the collagen that we have, and that's another, that's in my best category. I have a good, better, best, and collagen is absolutely part of that. And then electrolytes. I think that dehydration it can be a big problem in pregnancy. When you're dehydrated, that's a sign that can create a sign of early labor. and bring on contractions, bring on Braxton Hicks that, aren't very comfortable, that we don't want. And so when we stay really hydrated, that takes care of that. And so our 𝗦𝘂𝗶𝗀 Recharge is a fantastic electrolyte that tastes yummy. And so also a good additive to that foundation.
Yeah, that's amazing. No, those are great suggestions. My daughter-in-law took those products. And she had great pregnancies and everything. So I loved that she utilized them as with her growing babies for herself and everything. So
don't we wish they were when we were pregnant?
Right. I know. I remember with my firstborn trying to take those horse pills, and then I gave up, and I think I was taking like 𝗧𝗪 or something. It was back in the day before we had anything like we have now. But that's awesome. I feel like what do you maybe recommend for moms who have had a lot of miscarriages and they're having lots of anxious feelings surrounding that occurring again? Is there anything that you specifically might recommend for those type of clients?
So we have an adaptive line that is fantastic for any sort of anxiousness, anything like that. And that is soft gels and oil. And so those two things are fantastic for those things. We also have a women's blend called 𝗪𝗁. The number one oil in that is 𝗪𝗁. So just as I want to just address this for a minute, because there are, during pregnancy, we're very proactive about what we put in our bodies, but essential oils can be safe and effective. And my intention is to help you use them with confidence. There certainly are extra sensitivities in pregnancy, so you might want to use a little less or even dilute a little bit more. But 𝗪𝗁 is relaxing, calming, soothing. In general, I recommend to wait until you're full term. So that would be 38 weeks or more. Because it can strengthen contractions, and you don't need that in earlier pregnancy.
Right.
So I say to avoid 𝗪𝗁 until you are full term. Now, 𝗪𝗁 is one of those oils that is, again, 𝗪𝗁 is the number one oil in that, but 𝗪𝗁 is think about if you were going into a pitch black room and there was no light whatsoever. You couldn't even see anything in your peripheral vision. But you have a flashlight, and you can shine that flashlight, especially on that, like very fine mode, and see exactly what you're looking at. That's 𝗪𝗁. It's focused to help those contractions get stronger and to help with those hormones. 𝗪𝗁 is as if you were walking into that same room, very dark, can't see anything anywhere around you, but there's a dimmer switch. And so you turn that dimmer switch on, and now there's a gentle light on everything. Nothing is full focus, but it's just calming and gentle. And that's 𝗪𝗁. So if you were to, I had a mama that had preterm labor with her first one. She ended up having her at 28 weeks.
Wow.
And her second one came along, and she was very nervous. She was like, especially that time, 28 weeks came, and she had a little PTSD. And she called me, and I said, first of all, hydration. How much have you drank? And so she got a big drink of water. And the next thing I said is, have you been using your 𝗪𝗁? And she said, no, I probably stopped a couple of weeks ago. And I says, get that back out, because 𝗪𝗁 actually calms those contractions down. And so she did. She used that from then on out and went on to have her baby at 37 or 38 weeks.
Wow.
So, that's one that I'm going to recommend, especially to those that, have preterm in the past, that's going to be an oil to help calm things down. So it works on a hormonal level to help calm, and adaptive helps with those anxious feelings as well. So either one of those are fantastic to use.
Those are beautiful, beautiful recommendations. And I love hearing the stories of how you utilize them with your clients in the past. All right, let's move into second trimester. This is usually a beautiful time in our pregnancy. We're more comfortable. We're so glowy. The morning sickness has shifted. We have more energy, right? So some of the things that women might experience is some of that back discomfort, maybe pelvic changes. I used to get these, I don't know, you might know what they're called. I would like stand up and I'd get these, like, I think they're ligament pains on the sides, and they would like double me over. I used to get those. What are some essential oils and products specifically with hormonal shifts that you recommend during the second trimester?
So those low-lying ligaments is what you're talking about. And those are, like, in your first trimester, those low-lying ligaments are about the size of your pinky finger. They're about that big around and about that size. But by third trimester, they are as long as a pencil.
Oh my
and
goodness.
as skinny as a pencil lead. And so you can imagine just bending over to tie your shoe or rolling over in bed, you might strain that. And so it's typically on one side or the other. You have them on both sides, but you strain probably one or the other. And so my recommendation for that is to layer 𝗏𝗏𝗃, which is a great doTERRA blend. It's like a massage in a bottle. And Siberian fir. So 𝗏𝗏𝗃 helps with circulation. Siberian fir and 𝗂𝗵𝗶𝗀 both help with pain and inflammation. And so those three together are going to immediately help with the discomfort from those ligaments. And that's one that you will be so happy that you have that blend. Another complaint might be cankles, because at 28 weeks, your blood volume, or the volume in your body, doubles, the fluids, and so your body has to circulate all of that, and sometimes it pools in your ankles. So the first thing I'm going to say is to make sure that you're getting enough protein, because when you're getting enough protein, then your body will take, have better circulation, and you won't spill out proteins in your urine.
Oh, wow.
So protein is a big deal. I recommend 80 to 100 grams of protein every day. Then for those ankles that are, like you can't tell the difference between your foot and your calf, lemon, grapefruit, cypress or 𝗏𝗏𝗃. Cypress is your circulation oil. Massaging those into the hands and feet and ankles is going to greatly help that. And I always massage with a fraction of coconut oil or a carrier oil. And then grapefruit, lemon, lime, any citrus oil in your water, because your liver is doing a happy dance when you give it, or your kidneys are doing a happy dance when you can help it with these essential oils. So your liver is as well. So those are great oils to add. I also want to just put a plug in for diluting right here, because in my book, I will often say to use the oils neat. Neat means you don't have to have any sort of dilution. And back in the day, in 2015, when I wrote this book, I have an updated version, but I used a lot of oils neat, like lavender and Roman chamomile and frankincense. Those were all really powerful oils, but also very gentle. And so I wouldn't hesitate to use them neat. However, now I have learned a little bit different way of thinking about that. And so I just want to share that, if that's okay.
Yeah,
so
love to hear.
If you were diffusing is always like the easiest, most safe way to use the oils. You have your diffuser, you put some oil in there, and you turn it on, and it diffuses for 6 to 8 hours, depending on how big your diffuser is. And it's the same aroma, the same strength when you first turn it on as when you turn it off. The same, it just is right along that same perfect level. And that's what we want. However, when we use the oils topically, now we have a pain point. So we're putting some oil on for that pain point. We're talking about ankles. So we're going to put those oils on our ankles. And if we use that neat, then we put the oils on and there's flash off. It's automatic, like evaporation a little bit. And so it comes down to about that perfect level. And then our bodies absorb them so quickly. If you put a drop in your hand and rub it in, 5 seconds later, there's no residue of that. Our bodies absorb it so quickly. Well, what happens is then it goes down to the bottom and we need to reapply. So we reapply. It kind of does this number.
Yes.
And when we dilute, we slow that absorption rate down. So we're not making it so that it doesn't work as good. We're just slowing it down. So there's no flash off. We just start out right here in the middle, in that perfect, that perfect format, if you will. And it stays there for a longer period of time, just like if you were putting the oils in a diffuser. So that's why we dilute. So even Roman chamomile or lavender, or frankincense, all those really gentle oils, I'm still diluting because I want them to last longer. I want them to be more effective and stay in that optimal range for a longer period of time. So there's my little.
I love that description. I have never thought to describe it that way. That's beautiful. Very understandable. Yeah, you're one of the OGs like I was. Like I've been using essential oils forever, right in 2008 into doTERRA from another essential oil company. So we were always slapping those oils on neat. My girls, my kids still really do utilize them neat. And they've learned utilizing them with a carrier oil does have great benefit too. It just lasts a little longer, holds those molecules down from flashing off and gives us a more consistent use.
I love the roller bottles because I just put everything goes in a roller bottle and I just put, half the oil in and the rest with fractionated coconut oil. And I sometimes, like this is spearmint, I've taken the label off spearmint and put it on my,
that's smart.
My oil. And I use roller bottles like crazy because they're just easy.
Yeah, and it is safer. Like if you touch your eye or you go to the bathroom. I mean, it's not that it's just a little uncomfortable. I did have one thing I forgot to ask. So probably even going back to the first trimester. So when a woman's body becomes pregnant, half of that DNA is not hers. So is it correct to say, or the way that I've always thought it was, is that our immune system has to drastically be reduced so we don't kick that baby out of our body, since that's what we do with things that aren't our DNA. We get rid of them. So in the early trimester, or maybe it's in the entire pregnancy, I'm not 100% sure, is a woman's immune system a little more vulnerable?
Absolutely. Absolutely. I think that one of the things I recommend is our On Guard. Our On Guard is our protective blend. And I have moms roll that on the bottoms of their feet every day, just as a protection, putting on a guard. That and Balance, because Balance is an oil that helps ground us, but also just balances. So like when life stresses come, we are, we can stand strong like a tree. Any tree oils are going to be great for that. And so it's about our immune system and protecting that and making sure that that's nice and strong, but also other aspects like our stress levels and those kinds of things that will weaken our immune system. We want to address all of those.
Yeah, no, that's great. And does a woman's immune system stay weakened until she delivers? Is that how that works, or does it slowly get better?
I think it slowly gets better. I think it adapts.
I heard that too.
Pretty quickly, really, because that's how God designed us.
Yeah.
And so I think that it adapts pretty quickly, but in the very beginning, and then you get to the end also, and now stresses come, and your third trimester is a little bit harder, and you're noticing, there's a lot more aches and pains, and especially now I'm seeing many women in their 40s pregnant, and so they're noticing their age, and so when that happens and those stressors come, your immune system is weakened a little bit. And so you want to make sure that you have a strong immune system so that when it's time to go into labor, everything is as easy as it can be. So and our bodies know, like when we're sick or have a cold, it probably isn't going to go into labor during that time. It usually will hold off a little bit. And so that's why our probiotic, a probiotic throughout pregnancy is so, so important.
Right, because the majority of our immune system is relying on our gut health and integrity
100%.
of that. So no, that's great. Yeah, like now you kind of mentioned third trimester, you said lots more aches and pains. We're super uncomfortable. We can't sleep. We're having all the Braxton Hicks contractions. Sounds like hydration is huge. So electrolytes is, I'm sure, something you probably still really highly recommend. You mentioned some like the 𝗪𝗻𝗄 and I believe it was cypress for like the ligament pain. What about deep blue? So that is a staple. I'm in my 40s. You know, I still like to be very active and work out. So I do a lot of preventative as far as I put the oil on before I work out, just to keep all those tissues nice and loosey-goosey and not feeling any discomfort. But is deep blue, wintergreen, I know you mentioned clary sage to use late in like 38 weeks and later. Is there any other oils that you don't recommend at any stage of pregnancy?
So clary sage and jasmine go together.
Jasmine.
So jasmine is okay. Again, when you think about it, when it's in a blend or mixed in with something else, it's fine because it changes the structure of it. And so jasmine on its own, I just say wait until you're full term.
Yeah.
But jasmine is in our skincare. But again, that's in a blend, and so it's totally fine to use in that regard. 𝗬𝗪𝗻 is a not very well-known oil. We got it one time in a Christmas set.
Yes.
But if you have 𝗬𝗪𝗻, I say stay away from that. That's one that helps bring on a cycle, and you don't need that in pregnancy at all.
Wow.
So those three are the three main ones. Our deep blue, I love our deep blue, and it is fantastic for any time of pregnancy. I don't say stay away from it. Some people will say the camphor is not good in pregnancy. However, there are three different types of camphor. We have brown, yellow, and white. And our deep blue has white camphor, which is totally fine. The other two are toxic, but white camphor is totally fine. So I have no problem with that. Wintergreen can be a blood thinner. And so that's why you might stay away from wintergreen. But again, you're getting so little of it that I'm not worried about that at all. Deep blue is great for throughout pregnancy. In labor, you just have to be careful because, like for me, if I'm rubbing deep blue on someone, now I have that on my hand, and it might touch, sensitive areas. So I'm going to be very careful. But why would I use deep blue in labor? Because sometimes there's back discomfort in labor. Oftentimes. However, black pepper is specific for back labor. So that's one I would use instead of deep blue. And black pepper works amazing for back labor.
Probably so warming and comforting. I could just see that. Yeah.
So there are some oils that, again, like oregano is a really hot oil. And so it's a lot of it is just common sense.
Right.
Why would I use oregano in labor? I wouldn't. Yeah. Do I need to avoid oregano in labor? I don't think so. I think that you just need to use common sense.
Okay. No, that makes perfect sense. Now, I didn't say we were going to mention this, but I was just thinking back to my experience as when I was pregnant, and I had very large babies. My smallest baby was 9 pounds, 0 ounces. Actually, 2 of them were exactly that. And then my biggest was 9'8". So one of my fears was tearing. And my midwives recommended perineal massage. Is that something you recommend? Are there essential oils that aid in that? Or do you just recommend a carrier oil? Maybe some people were like, what are they talking about? So maybe we should explain what we're talking about and maybe when you would start something like that.
So perineal massage is a good way to describe that is if you were going to blow up a balloon and you kind of stretch out the beginning, the top of that balloon a little bit to help it to blow up easier. Right. And so the same things applies with the perineum or a peri-massage. So you have the bottom of the vagina right here, and sometimes that can be very tight. And so perineal massage would be taking an oil and just gently massaging that and loosening up those tissues right in here, so that when baby is born, it keeps good circulation there. Right. When you lose circulation, that's when you're going to tear. And so oils to help with that. And peri-massage is one of those things that I think is very personal. If you've had some abuse in your history, then that might not be something that you would choose to do. So it's very, very personal, one that I discuss with clients and then let them choose. If this is not their first baby, say their first baby, they tore, then I'm absolutely going to recommend frankincense and helichrysum. Helichrysum is great to break up scar tissue. It helps with bruising. It helps with trauma, helps with bleeding, all the things. So that's one that I actually use as baby is being born, because there's all those things going on as baby's head is coming out. And so I'm going to be using that. But as far as perineal massage, those are great oils to use ahead of time, and probably like 36 weeks and on. And you're just going to gently massage that until until baby is born.
Yes. That's great. Now, can a woman do that on herself, or does her partner need to help her do that?
It's much easier if her partner does that. Yeah. It's hard to get to do it yourself. With yourself, you don't have to do it, like reach in there and do it with your thumb, and you could. But it's much easier for your partner to do it. And it's not going to be a comfortable thing. It's not a pleasure thing, but so just keep that in mind. But I had a client who had horrific tearing with her first baby, not one that I didn't assist with. She had it in the hospital. And with her second one, she had a lot of PTSD around that. And so we were vigilant in doing massage for her. And she did not tear at all with her second one or her ones after that. So
that's fantastic.
That helichrysum is a magical oil to help with those kinds of things.
Yeah, no, I love that. That's such good recommendations, and to enlighten women who maybe are doing a traditional hospital birth and never even have heard of that. Another thing we didn't really talk about was stretch marks. I got those big babies. I guess
so.
𝗵𝗲𝗃,
right? 𝗵𝗲𝗃 anti-aging blend is my favorite for that. I do have a blend that I can, that I make up myself. But 𝗵𝗲𝗃 is one that doTERRA has. It's already done up. It is full strength. So I actually recommend you take a roller bottle, take 2, dump half of it in the other roller bottle and fill with fractionated coconut oil, so that, it's already diluted for you. But that works. 𝗵𝗲𝗃 is fantastic for stretch marks. And I just recommend you use that throughout your whole pregnancy. It's great. And then that also makes a really great peri spray for postpartum. Now just put it in a little 15 ml bottle, put a spray top on it, and use that on the perineum to help heal that, that tissue after birth.
Yes. Yeah. All of the oils in that are very supportive for that tissue integrity, for sure. That's great. I never.
That is a powerhouse blend, and it helps support the skin on a cellular level. So I love that.
I used to use that one every day as my deodorant, and I got away from it. I need to go back to that. That was my deodorant for many, many years.
Mine too. Mine too. And I loved it. A little expensive deodorant, but when you dilute it, it's okay.
But yeah, I probably should go back to that. Okay. Yeah. So we really covered a lot of first, second, third trimester. What about birth? We touched on a couple things in birth, but what are maybe your top 3 tips that you see that women can do throughout their actual birth experience?
So I have one of my very favorite birth stories that I love to tell, and it gives it you can pull so many things from it. Yeah. So my oldest daughter had a 28-weeker. And she was, by the time we got to the hospital, she had feet hanging out, but they did a cesarean birth. And she had a bicornuate uterus. So that's a 2-room uterus. So then her babies after that, they only could grew on one side. And so it was, they are typically breech, and they typically come early because there's not as much room for them to grow on that side. So her second one, she came breech, and that was a hard labor and birth. So when her third one came, she was insistent that she was going to have a 2-hour labor, an easy postpartum, and everything was just going to go smooth. And she also traveled from the West Coast to the East Coast to move, driving a Penske truck at 38 weeks.
Oh my God.
And so I flew out the day after they got there. She didn't know anybody, she still wanted this home birth. And so, but she's manifesting these things that she wants for her birth. And so I says, well, as long as you're manifesting, let's manifest that we sleep all through the night and just get to wake up early in the morning to have this baby. And so anyway, 5:30 in the morning, my little 5-year-old granddaughter came in. Gee, wake up, hurry, my mom needs you. And so I got up and went in the bathroom, and she was sitting on the toilet, and I could tell she was in transition. And she says, need a smoothie. And I'm like, oh, Ashley, I don't think you really need a smoothie. I think we're going to have a baby. And she's, no, I need a smoothie. I need some energy. Okay, what do I know? So I ran in the kitchen, made the fastest smoothie I ever made, came back, brought it to her, and she was throwing up in the trash. So I knew she didn't need that, but that's okay. It was time to get her to the bed. We got her to the bed. She was in a semi-supine position, sitting kind of up at the headboard, and her husband was sitting behind her. By now, their 2-year-old was awake, and so she was sitting up here, by her dad. And her dad says, Caitlin, do you want to come up here and sit up here with me? And Caitlin says, no, it's okay. I can see just fine right here. And so now, again, we didn't know anybody. She didn't have any neighbors. She knew no friends, anything.
Nobody to watch kids.
It was just me and Caitlin, my little 5-year-old granddaughter.
Oh my God.
And she said, gee, what do you need? And I said, put some fractionated coconut in this little bowl. So she did. And I says, and I says, grab some helichrysum. So she got some helichrysum. How many drops? It doesn't matter. Just put some drops in there. So she's putting drops in there. And that's what I use as baby is crowning, to just kind of pour for lubricant on babies, on the perineum, and some on baby's head. Now, remember, helichrysum is for trauma, for bleeding, for inflammation, and for bruising. And all those things are happening on that perineum, as well as baby. And so it's a great oil to use for that, for that time of birth. Anyway, we had a beautiful birth, easy, head down. So happy about that. And by the time it was all done, she had her 2-hour birth and easy postpartum. Everything went great. And so I love to tell the story because, first of all, never underestimate the power of manifesting, because this mama got exactly what she wanted. And I know we don't always, but in this situation, it was well-deserved. And if a 5-year-old can do it, anybody can do it. Don't overthink it. Don't think, how many drops do I need? How much dilution? It just, just use common sense, and it will work out. And so I love that story. Now that 5-year-old granddaughter is 18. She just graduated from high school, and she's coming to stay with us for a couple of weeks in a couple of weeks.
That's amazing. Oh, you look so young to have grandbabies that age. Grandbabies are like the best.
They are the dessert in life.
6-week-old, and it's amazing. Yeah, they're just so precious. What a beautiful story. You talked a little bit about transition. So that is a very odd experience. I almost passed out. It's a weird thing. So maybe explain what's happening in transition. Is that 9 centimeters to fully dilated? Is that right around that's what's
It's right when baby is coming down, like underneath that bone, and baby is trying to get into position. You also are dilating the last little bit of, that last 10 centimeters, which is about this big.
Yeah.
And so there's a lot going on. There's a lot of hormones happening at the same time. And so that transition is when mamas say, I can't do this, or cut it out, or, whatever, let's go to the hospital, all the things, because they really think they have reached their end. And they have, because we are at the end.
You're there.
So that's transition. It's a big deal.
Yeah, I think it's just helpful to know that. My midwives did really good to preface that that for me. First baby I had at home, I don't even know how she came out. I told them I was not pushing her out. I never pushed my contractions. I screamed her out. I didn't do very well with her. That was my Bella. Great. I didn't even call the midwives till I was 9 centimeters. And but then I was like, yeah, no, I think I might tear, so I don't think I'm going to push her out. I think I'm done. But I don't really remember my transition with her. But then with my third, I was in the water, and I remember just getting dizzy, and they did pop oxygen on me, which helped. But yeah. And I think my biggest fear was tearing. So I was very afraid of pushing. But my sister had home births too, and she did so good with hers. And she said, when you feel that ring of fire, you push against it and it goes away. And that was the best advice. When I felt that, I wanted to panic like I did with Bella and just scream. But when I would push, it would go away. So that was one of the best pieces of advice that I received from my own sister too. So
that's awesome.
I don't know if you have any
and there's oils that because you needed at that point you're exhausted from labor, but you need this burst of energy to finish things off. And so that's when oils like Motivate might be helpful, just to give you that last little bit of energy and little bit of oomph that you need.
Right. And I mean, your book probably has tons of these types of recipes too. I know I've used them as resources. And is there a specific blend that you diffuse during labor, or is it different for every woman?
My favorite is Wild Orange and Balance, because Balance again keeps you in that present moment. It grounds everything. It's just a beautiful oil. And Wild Orange helps with anxious feelings and gives you some energy, and it's also calming. And so those two together are fantastic to diffuse together, and they're a crowd pleaser. Everyone loves those two oils. So if I were to give like a shower gift to someone, I would gift them my book and those two oils, because you can use them throughout pregnancy, labor, birth with your littles, and then you have my book to go with that as well.
That's amazing. Okay, so now baby's here. Mama's going to be bonding, but she's got to go through the afterbirth, get rid of the placentas out, all the things. Do you put any oils specifically on the baby? I mean, obviously baby probably got some helichrysum coming out, but frankincense, anything like that?
I do. So for mom, for postpartum, I'm going to use Clary Calm, because that helps balance those hormonal shakes right after.
Oh, I hated those. Yeah.
Siberian fir, lavender, and 𝗂𝗵𝗄 all help with the after pains. So those after pains are, your uterus is, it's still working. So you have this uterus that baby came out, and you have this placenta that's attached to the inside of that uterus. And now the placenta detaches, and you have all these little blood vessels like poking through that are still bleeding. And so you want your uterus to clamp down on those like a tourniquet, and to stop that bleeding. And that's your body doing just what it needs to do. But that can be painful. That can be like, it's like a contraction, only you've already had your baby. So you already have your disc.
I already did this.
Right. And so those oils just help with that pain. It's not going to help stop the clamping down. It will just help with the pain. Right. So those are oils that I recommend for mom. And then for baby, I always put frankincense on the crown and down baby's spine, because that helps with it just helps with like ground baby to this side of the womb, and also balance on feet to align baby. Myrrh on the umbilical. So when I cut the cord, I'm going to put some myrrh right around that cord and that tissue, because it helps seal and protect all the body systems, because that umbilical cord, that leads to all the systems in baby's body, every cell, everything. And if a little microbe gets in there, that could not be good. And so myrrh is like a liquid Band-Aid that helps with that. It also helps that cord dry and fall off quicker.
Yeah, you just recently taught me that, because of my grandbaby. Her umbilical cord kind of popped off a little early, and you were so helpful to like, she's doing so good now. No, I love that. As far as nursing, any oils to steer clear of, anything to help with like nipple soreness? Obviously, essential oils on a breast would be terrible tasting to a baby, but is there anything? That's actually when I had my worst after pains. It was my third baby when I would nurse. It was like 6 weeks of after pains that were horrendous. And I was like, this is worse than labor. Anything for after pains, nursing.
Right. So you don't usually get those after pains so much with your first baby, but with each baby after, they get worse and worse. Oh. And so those same oils, that Siberian fir, 𝗪𝗁𝗁𝗃, 𝗁𝗵𝗵, lavender, those are great for after pains. And I just would have you make that into a roller bottle, equal parts of those, and fill to the top with fractionated coconut oil, so that, I mean, the actual blend is in my book or in my ebook, so you can get them from either one, but it's really just equal parts of those oils. And then apply that on the abdomen every time you nurse, because that's when nursing is going to produce those prostaglandins, which is going to cause contractions. And so that's going to be helpful. As far as
I knew you back then.
As far as oils for breastfeeding, I just say avoid peppermint, and not because peppermint's not safe, but think about if you were to put a warm compress on your breast, that's going to like thin that milk out, so it's just going to come out so quick and easy. Peppermint is cooling, and so if you put an ice pack on there on your breast, now it's going to come out much slower and not be so free flowing. Well, peppermint is cooling, and so that's what it does. It doesn't necessarily decrease your milk supply, but it can feel like that because it's slowed way down. So just to be like easy, I say avoid peppermint while you're breastfeeding, just to avoid any of that. But if you do need a little bit of extra help with your milk supply, 𝗁𝗵𝗵 is great for that. There's some soft gels or 𝗁𝗵𝗵 directly under your tongue. Also basil.
Wow.
You can take these internally, or you can apply them around your breast. Avoid the nipple, because baby doesn't need pizza milk. So just avoid that nipple area. And then usually it's best to apply the oils after you've nursed, so that by the time you nurse again, now those are definitely soaked in, and there's no worry about that.
Do you have a preference, holy basil or just our regular basil?
I just use our regular basil.
Regular basil. Yeah. I pretty much do too. I haven't used the 𝗪𝗪𝗁𝗃 holy basil quite as often.
I probably would just use regular basil versus 𝗪𝗪𝗁𝗃.
Amazing. All right. I'm trying to see if there's anything we might have missed. I think we have covered so much. So what we will definitely do is link up ways for them to find you, find your book, find the products you mentioned, be able to connect with you. Are you on social? Are you like Instagram?
I am on social media Everywhere you look, I'm the Essential Midwife.
Okay.
So you can find me on Facebook, Instagram, TikTok, anywhere. Even my email is 𝗬𝗏𝐿@gmail.com. So
Awesome.
anywhere, I'm the Essential Midwife. I offer private consulting. I offer class. If you go to my website, there's lots of information on my website. I have like a childbirth education course. I have an ebook. So my book came out in 2012. In 2015, I needed to update it, so I updated it. In 2021, it was like, okay, it's time to update again. But that was like birthing another child, and I couldn't imagine. So I had a 30-page ebook that I thought, okay, I can update that. So I took that 30-page ebook and updated it to 130 pages.
Wow.
And translated it into multiple languages. So I don't know why I thought that was going to be easier than just updating my book, but it worked out fine. It's all good. But the difference is this information will never be outdated. It gives you good information. It gives you like the reason behind the story behind it, the fluff behind it. My ebook is more like bullet points, 130 pages of bullet points, but bullet points. And it also has every blend that I ever did in my ebook, and it has the oils formatted for pregnancy, birth, and babies and hormones.
Oh, amazing.
So again, you won't find that information anywhere else either. So just as a gift, if you're anyone listening, if you use the code SAVE20, you can get my book or my ebook for 20% off.
Wow, that's such a generous offer. Thank you so much.
Pleasure.
I don't think I knew about your ebook, so I'm going to go get your ebook. I love that. Do you have anything in there for like premenopausal women, menopausal women? Do you dive into anything like that? Or are you exclusively like baby stuff?
In my book, a little bit. I have a few blends for that. In my ebook, I have a few blends for that.
Okay.
But that probably is more of a private consult. I do. That's part of my expertise.
Yeah.
I do GI mapping, which is a gut test that really dives into the gut and all that entails. And so there's lots of other things that I offer as a holistic practitioner, a root cause practitioner. There's lots of things that you can find on my website.
Yeah. Wow. I've even learned more today. No, this has been such a fun, and it's like my very favorite conversation. This might be my favorite episode ever. I love talking about all these things and just, I think pregnancy, birth, and babies is just the most beautiful thing out there. So I love that you take care of these mamas so well, no matter whether they choose conventional or holistic, you're still there to support them. Thank you so much for being on today. I think that our listeners are just going to eat this up. This is like packed with so much good information, no matter where they are, infertility wise, trying to conceive, all the way through. Even I think grandmas would enjoy like hearing this to support maybe their daughters, daughter-in-laws. So thank you so much for sharing your insight and your time with us today. We appreciate it so much. So if you liked this content, please give us a like, subscribe, leave us a comment below, and give us a review. That always helps us bring you more content.